There has been a lot of buzz about Chat GPT, and recently, or at least I found out recently, Google launched Bard as their own AI. Now, I've been in the emergency room doing my emergency rotation, so I decided to ask this AI, that is Chat GPT and Bard, questions about the common medical emergencies that I see. Let's see how accurate that they would be answering. If this is something you're interested in, stay tuned. Hi, my name is Dr. Ata, and I am a mom and a medical doctor living and practicing in Nigeria. If you're a new subscriber, hi, you're welcome to the family. If you like this video, you can check out my other content and subscribe and join the family. If you're a returning subscriber, welcome back. Let me go to the Chat GPT. So the more information that you give it, typically the more it will give you back. Let me type in what I have written here. So I would say, hi, I am I'm not anyway, resident doctor in the emergency room, and let's see, what was the first? And I have a patient with stroke. What do I do as I can't reach my seniors? Let's see. This is a lot. This is a whole lot. I'm going to read out the parts and then just tell you guys whether it's accurate or not. This is interesting. This is really interesting. Okay. So let me read what it has written. Okay, so it first of all starts with, I'm not a doctor. Of course, you're not a doctor. You're ChatGPT, your AI. And it says, I can offer some general advice. So let's see the advice that it says. Assess the patient, check the airway, breathing and circulation. So yeah, this is something your thoughts. For every emergency, you have to do the ABC of resuscitation, including the airway, the breathing and the circulation, because these are things that can, determine whether a patient lives or dies in the emergency room. So it says identify stroke symptoms. I should have done that if I think if the patient has stroke already. So let's keep that. Activate the stroke team. Okay. So it says if your hospital has a stroke team or code stroke protocol, activate it immediately. Notify the appropriate personnel such as the neurologists, the radiologists and nurses specialized in stroke care. But I just told you I can't reach my seniors, and that's why I'm asking ChatGPT. So that's the difference between AI and a human anyway. Let's see. Perform a neurological assessment. Assess the patient's neurological status by checking their consciousness, pupillary reaction, strength, coordination and sensation. Remember to use the NHI stroke scale or a similar tool if available. Okay. Other necessary tests. Request urgent imaging, typically a non-contrast CT of the brain, to determine if the patient is experiencing an ischemic or hemorrhagic stroke. Okay, this is really what we do, because once you see a patient that you're suspecting stroke, you have to determine whether it's an ischemic or hemorrhagic stroke. Now, an ischemic stroke is that the blood vessel that is supplying the brain is blocked, while a hemorrhagic stroke is that the person bled into their brain. So this is actually very important, and it's actually only a brain imaging that can give you this. And okay. Are you sure AI will not replace us in the future? Wow. Monitor vital signs and provide supportive care. Ensure the vitals are stable, administer oxygen if needed, and establish intravenous access. Keep the patient on a cardiac monitor and monitor their blood glucose levels. Okay. Time is critical. Yes, time is actually critical. We have something we call the golden hour, which is 4.5 hours. So between the time that the patient is having the stroke and intervention has to be 4.5 hours, which is why it's really frustrating when a patient is coming in with a stroke of 1 day or 2 days or 1 week. The golden hour has passed, and what you can do is secondary prevention. So it's not like you cannot do anything, but essentially you're trying to prevent another one from happening. The one that has happened has already happened. Okay, so they said time is critical. If an ischemic stroke is suspected and your hospital is equipped to administer thrombolytic therapy within the time window, notify the appropriate specialist immediately. That's true. You can't just give people TPA. What you give TPA when it's an ischemic stroke? If it's an ischemic stroke, that means there's a clot, a blood clot. Normally, if you have a wound, the thing that stops the bleeding is a blood clot. So when you have an abnormal blood clot in the brain, that is the ischemic stroke. There's a blockage to the blood vessels. So you give TPA to sort of, for lack of better words, melt the clots. But this has to be done within that golden hour. So that's what they mean by the time window. This is really accurate. Okay, let's try another one. Okay, so the second one I have here, I have a patient, I think is in heart failure. So I thought I already gave it a diagnosis, stroke. So let me see if it can make a diagnosis, which is very key in institute management in a patient. So I have another patient. I think is in heart failure. How can I confirm heart failure? But it means that Chat GPT might actually replace doctors in future. Really, what do you think? Tell me in the comment section. Okay, so it says confirming heart failure typically involves a combination of clinical evaluation, there's diagnostic tests, and medical history. As a resident doctor, remember that I was a resident doctor. It's important to consult with your senior colleagues or to follow your hospital's protocols. This is very accurate because the patients belong to the consultants, or if you're in the US, the attendants. Here in Nigeria, we call them consultants. These are people that already have their fellowship and they are the owners of the patient. So your trainee is under them actually. So yeah, that's very important that you follow either the hospital's protocol or your consultant's protocol, depending on what applies to you. So it says number 1 is patient assessment. Evaluate the patient's symptoms. So the symptoms, they said the shortness of breath, fatigue, fluid retention, that's swelling of the legs, ankles or abdomen, rapid or irregular heartbeat, and difficulty lying flat. Yeah, that's something we call autopnea. So patients that have heart failure, because of buildup of fluid in their lungs, if they lie down flat, they feel very breathless, so they can't lie down flat. So you typically see us asking how many pillows you use to sleep at night, because what people do is that they add to their pillows. So you see somebody adding 3 or 4 pillows to be able to sleep. Sometimes it gets so bad that people have to sleep while sitting down because they just cannot tolerate lying down. So yeah, this is correct. So physical examination, they said pay attention to signs such as JVP, yeah, abnormal heart sounds like S3, lung crackles, peripheral edema. Then do a chest x-ray, do an echo. Okay, blood tests like BMP, pro-BMP, ECG. Okay, then it now gives a note at the end. I'm interested in this note that it's given at the end. It says, remember the diagnosis and management of heart failure can be complex and require expertise from experienced healthcare professionals. It's essential to seek guidance from your senior colleagues or follow your hospital's protocols to accurate diagnosis and appropriate management of patients suspected of having heart failure. So it just keeps warning me to seek guidance from my seniors. So let me just say that my seniors are not available at the moment. My seniors are not available at the moment. It says that if you're unable to reach your senior colleagues, it's crucial to prioritize the patient's immediate needs while continuing to provide appropriate care. Here are a few steps: stabilize the patient's ABC or resuscitation, gather history. Then it comes back to inform the consultants. The consultant is whom I cannot reach. But this is nice. Okay, so they said to consult available resources, which is why I'm consulting Chat GPT. So but it now says online resources such as reputable medical websites or textbooks can provide valuable information to support your assessment. Actually, sometimes when you're consulting and the case is not very clear, or you can't remember something, because medicine is very wide and you're a human being, you can forget. We actually consult medical books, and a lot of us have our handbooks that we can just quickly flip and see, especially when it comes to management protocols. My department, for example, have an online resource, like an app on your phone, that has all the typical emergencies, so that if you're not sure of what to do, you can consult that app and see our guidelines. So that's like our hospital guideline where I work, which is something very, very helpful, because sometimes you can get so overwhelmed and you start to forget things because you're tired, or just because you're a human being. So let me go over to Bard, which is the Google AI. So let me see the question that I have. Let's see. I am a trainee doctor in the emergency alone, and I have a patient in cardiac arrest. Help. This one starts out with saying that as a trainee doctor, you're expected to know how to handle emergencies. Cardiac arrest is one of the most serious emergencies that can happen, and it is important to act quickly and correctly. Here are the steps on how to perform CPR on a patient in cardiac arrest. So I like the way that this is starting, because if you have a patient in cardiac arrest, the first thing you have to start is cardiopulmonary resuscitation, aka CPR. So even if you don't know what to do, chest compressions, everybody, you don't have to be a doctor. Everybody has to know how to do chest compressions. Like, this cannot be overemphasized, because this is the key between someone surviving a cardiac arrest, heart attack, and someone not surviving a heart attack. So once someone is unresponsive, now I think the guidelines is given are very important. It says, check for responsiveness, tap the patient on the shoulder and shout, "Are you okay?" If the patient does not respond, call 911 or your local emergency number. No, we don't have 911 local emergency number. So what you do in Nigeria is, if you tap the person and the person is not responding, call someone that has a cat to move the person to the hospital. That's just what you can do, right? Check for breathing. So place your cheek next to the patient's nose and mouth, and look for the chest rise and fall. If the patient is not breathing, start CPR. So they said, put your heel, that's the heel of your hand, on the center of the patient's chest, just below the nipples. Place your hand on top of the first and interlock your fingers. Press down hard and fast, using your body weight to compress the chest by about 2 inches. Continue CPR at a rate of 100 compressions per minute. So this is very, very accurate when it comes to CPR. So yeah, lock your hands. Let me stand up so that I'll demonstrate something. Sometimes sorry, you cannot see my face, but sometimes when people are doing CPR, they do like this. No, to be able to get your weight on the person's chest so that the CPR can be effective, your elbows have to be locked. So the movement is coming from down this way. So you're not moving your hand like this. You're actually using your weight to press down on the person, having locked your fingers this way. I don't know if you can see my fingers. So that's actually the way to go about CPR. I hope that helps somebody. So the next thing that it says is, use an AED if it's available. Well, we usually don't have AEDs available. Sometimes even in the hospital, we don't even have an AED machine. So you continue CPR until help arrives. So you continue CPR till you get to the hospital. Now remember that CPR is not a cure for cardiac arrest. It's a temporary measure that helps to keep the blood flowing to the brain and other organs until the heart can be restarted. This is very true and this is very correct. That's essentially what CPR is supposed to do, while you look for what is causing the heart attack. So I think so far the AI has performed well, but it's giving general advice. So I don't know. I don't think at this point it can replace doctors and other healthcare professionals. But maybe it's going to get more sophisticated in the future. I mean, who knows? But the information it's giving, it's accurate, but it's providing this disclaimer that remember it's not a doctor. So I think AI is not bad. It's not it's not a human being, so it's performing like a computer. So it's like garbage in, garbage out, but it's a good resource in the right hands. So tell me what you think about AI. Tell me what you think about the performance. If you think that it can replace doctors, tell me in the comment section. If you think it would not, tell me in the comment section. Have you ever tried Chat GPT or Bard, and what did you think about it? What field did you use it with? I've come to the end of the video. Thank you so much for watching, and I'll see you in the next one. Bye.